Hi, I'm Dr. Raghunandan, Director and Chief Orthopedic Surgeon of Rathi Med Specialty Hospital, Chennai, India. Hi, I'm going to talk about personalized kinematic knee replacement. What is it? Traditionally, knee replacement has been done successfully for the last many years, which is done by the method called mechanically aligned knee replacement, where we have to put the implants in 90-degree angle to the axis of the bones of the lower limb. The problem with this technique is sometimes we may have to release the ligaments to put the implants in about 10 to 15% of the patients. In those patients, they are not happy after the knee replacement as we have to release the ligaments to put the implants in. And in complex cases where the deformity is very high, we may have to do complex knee replacement where the implant cost goes up and also prolonged surgery, and the life of these implants do not match the regular knee implants. That's where the personalized kinematic knee replacement comes into play, where we've been doing this technique for the last 7 to 8 years, where we position the implant based on the individual shape and size of the bones, which means we tailor-make the implant position for each patient. In this technique, we don't need to release any of the ligaments, thereby the knee is perfectly balanced and the patients recover very fast and they walk as soon as 3 hours with minimal blood loss and rapid recovery and equaling the same survival of the regular knee replacement. That is the advantage of personalized kinematic knee replacement.